Hello and welcome to Black Voice News' Care in the IE podcast. I'm Alyssa Hall and I'll be your host. Today I'll be speaking with Crystal Foster, a caregiver for her son Tyler, who has cerebral palsy and developmental delay. And later I'll be speaking with Dr. Wessam Labib, who specializes in family and geriatric medicine at Loma University Health. Hi Crystal, how are you today?
Hi, I'm okay.
Yeah, thank you for being here.
Thank you for having me.
Yeah, so let's just kind of start out with, I saw in the article that you shared that you had given a kind of a traumatic birth to your son, Tyler.
Yes. So Tyler, who is 29 now, was born at 1 pound and 7 ounces.
Wow.
And so he was born premature by 3 months.
Oh my goodness.
Yes. So unexpected, didn't know it was going to happen. Lots of things happened during the process of his birth, which gave him the predisposition of the brain injury, cerebral palsy, all the things that come along with that. So, yeah.
Wow. And so you've been his caregiver all his life. So,
yes.
I think you shared too that he was in the hospital for a while before.
Yeah, so he was he was at Cedars-Sinai.
Okay.
And he was in the hospital for 1 year.
Wow.
1 whole year. He had his first birthday in the hospital.
Wow.
Yes.
I can imagine that's really...
Yeah, they were great. We sang happy birthday. We had a birthday cake, all the things, but he was still like really, really sick.
Right. And so how long have you been a registered caregiver through the in-home supportive services?
I would say since he came home.
Yeah.
So after 1 year in the hospital, they had connected me with a social worker before he came home. So they prep you for everything prior to coming home. And they had connected me with a social worker who was really great. Till this day, I remember her name. It was Kim.
Aww.
And she helped me so much.
Yeah.
And so she is the one that told me about going home and what that entailed and the services.
Right.
So that's how I found out.
That's amazing. That's really great that they were able to support you just right out the bat like that.
They were, and you got to think Tyler is going to be, he's 29, so you got to think that was 28 years ago.
Right.
Yeah, and back then it was not how it is today, even for people with special needs and disabilities. It was so different.
Right.
Yeah.
And so you also have 2 other sons as well, right?
Right. I have a 35-year-old son, and I have a 23-year-old son, so Tyler is in the middle.
Wow. How was it kind of growing up with, having these 3 boys and trying to...
So to put it out there, I was a teen mom. My first son, I was a teen mom, not very knowledgeable, just winging it. And then 6 years later, I get pregnant with Tyler, thinking that it was going to be just great, like going to have a great pregnancy, everything was going to be fine.
Yeah.
And then this happened and took me for a loop.
Yeah.
So the funny part or the oddest part is 6 years later again, because all my kids are all 6 years apart.
Oh, wow.
It just so happened to be that way. 6 years later again, I get pregnant again. And that's when I had my youngest. And took different steps to secure that pregnancy. But I did find out I had a history of premature labor because he was born early too, but not at the extent that Tyler was.
Right. How has the familial support been during this time?
That is a great question. So you mean from years back when Tyler was born or in the current?
We could start from when he was born to now.
I would say support back then, it probably was there. And I'm talking about like maybe connecting with other people in my situation and things like that. But you had to really search for it. So the hospital had a few things going on where they had meetings once a week and people would come in and tell their stories, but everyone's story was different.
Right.
It wasn't quite the same as mine. So I went because I needed the support, but I felt like I really couldn't connect. And at home, my family did the best they could. You have to think that this was everyone's first time going through this.
Right.
And I think, now that I think back, they didn't realize how bad maybe I was struggling because I hid it like a lot. And I just was like, I got to take care of my baby. He's sick. He's really sick, you know. So it was always just knowing that it wasn't me. You know, I had a husband too who was dealing with this just as well as I was, but maybe in his own way.
Right.
So it was us trying to support one another, but at the same time, how do you deal with having a child that is so severely ill? Yeah.
And the pressures of that, and just kind of maybe feeling like you want to give them your all, but also how can you give back to yourself? Do you know?
Yeah, that process, probably I was literally maybe like on autopilot. There was never that process to me.
Okay.
Like if I think back now to all those years, because he's 29, a lot of it is blurry because I kind of stayed on autopilot, or else I felt like I would just collapse.
Right.
So I just kind of like lived every day in the moment, making sure he was well, that he was really sick. I mean, I used to have nurses that would come to my house and they would be like, they would come a few times and they wouldn't come back because he was that sick. But we were living in it like every single day. So it was kind of like a routine.
Yeah.
And I knew how to take care of him. And it was like, I just had to keep like moving. We just had, you know, so we both, I think my husband too, we were like just kind of like on autopilot.
Right.
Yeah.
And a blessing that now he's, you know, at 29.
Yes.
So when did his health seem to turn? Like when did it?
So I would say when he maybe got about 5 or 6. So it's kind of, I mean, trying to make a long story short, he was home, came home from the hospital 1 year, really, really sick. He was on a lot of things. He came home with a ventilator, a G-tube.
Oh.
Yeah, he had a trach.
Yeah.
So his room looked like a hospital. And he didn't start to really progress and get better until he was about maybe 5. Because then that's when they introduced me to a school that they had that wasn't far from my house. And it was specifically it was a specific school for special needs children.
Right.
And so they introduced it to me. And at the time I was really scared because you have to think he was home with me for that many years. He was really sick. To think I would let him go off all day and trust who was ever there. But they did tell me that whoever was caring for him at my house could go to school with him. So the nurse went to school with him every day.
Wow.
And Tyler didn't walk. He wasn't really walking yet. So he had one of those little, the walkers where they're on the inside and they pull it.
Right.
Yeah, and he was really little. He was like 5 years old, but he was really, really little.
Yeah.
And he still had a trach. And so he started school.
Wow.
Yeah, not walking.
Wow. So you saw improvements after.
Yeah, not walking independently. And that was the start of him, his journey, really, to getting better.
Right.
Yeah.
Having that like interaction and kind of socializing with like the other, kids.
Right. Yes. And that school, I will tell you till this day, like, that was the best thing I ever did for him.
Wow.
Because he started to progress over the years, like to where he just was doing things that maybe in my mind I took for granted and thought like he couldn't do. But he had teachers who were very supportive, and they were like, no, this is our goal. He's gonna carry his lunch tray on his own. He's gonna walk, and he's gonna not need the walker. And he had a really great teacher. I remember her too. Her name was Tara. Aww. This house people like really like made an impact on me. And she had a organization, and on the weekends she would ask me like, we do horseback riding, these things, and she would literally come pick him up.
Wow.
And take him for the day.
Wow.
To go horseback riding.
Yeah.
So those things that now I think back like, wow, that was a really huge deal, but in the moment you just kind of like roll with it. You're just like, okay, like you know.
And for you to trust her, and then also what she was doing for you too, to give you a little bit of a break.
And I realize now, like, wow, she was like a good person.
Yeah. That's beautiful. Yeah. And so kind of along the lines of that, what have been some of your greatest joys, you know, raising Tyler?
Seeing how strong he is. Like, I think kids with disabilities, severe illnesses, and things like that, I just don't think we give them enough credit. I think they're like so resilient, and they're so strong, and they're strong-willed. And because they've been through so much, Tyler does not like to show weakness. He does not. He'll get mad before he gets sad. Yeah. He will he has a high pain tolerance. He doesn't show like if he's in pain. And I think that comes from the years of like not being able to express himself like he wants. Because I consider him nonverbal. Okay. You would have to be around him every day to understand his conversation. So he has built up, I think, layers in himself. And I could tell sometimes when certain things happen and he'll get upset, like really upset, and I'll be like, why does he get so mad, or why did he come home in a bad mood? But I think it's just a cover for just not showing weakness. Yeah. Wow.
And how did you kind of develop that language with your son? You know, you said you kind of identify him as nonverbal.
So he's not fully nonverbal. He can speak, but he speaks in really short sentences or like one word. Gotcha. So if you met him, you would say, "Hi, Tyler." He would say, "Hi." Yeah. He'd say, "How are you?" "I'm good." But not like conversation like you and I are having at all. Okay. And then a little bit of sign language. They were teaching him years ago when he was in school, and I try to keep up a little bit. So there's like a certain words like more, yes, thank you, like all those things that he still like we still do to this day.
Right. That's really cool. And then so now that he's outside of school, how do you transition that in your day? Like, do you stay at home full time or?
No. Okay. So he is in an adult day program. Okay. So we lived in LA, and he went to school there at the school I told you about. When he was maybe 14. Okay. We moved into the IE. We moved to Corona, and he was going to start high school. And I was really, really scared because he was coming from a school that was specifically meant for special needs kids. Right. Coming out here, going into a regular high school like they have out here, but they have classes for the kids that have, or adults, I want to say young adults, that have like disabilities. Right. So that was the transition. We came here, and having to take him to the high school and meet the people and readjust, that was another phase. Like, it scared me to death. Yeah. Because I don't know, like if you're my age, like I won't say how old I am, but when I was young, they didn't treat kids with special needs that great. Right. You know, they put them in the bungalows in the back of the school, and you didn't really know what was wrong with them, and no one explained it to you. So a lot of us, I think that because we weren't knowledgeable, and like we just didn't always say and do the right things, you know, and you know, me having known that position before, I was just really scared. Yeah. But the school that he went to, the high school that he went to when we moved out here, it was really great. Yeah. Like, they have best buddies. He had a best buddy. They would once a year hold a show in the auditorium, and they would have, like, they called it a what's the show, you know, where they dress up as characters and are different performers and they dance. American Idol. Oh, cute. So, well, they don't dress up, you know. I know what you mean. Yeah. So they had a show once a year that was called American Idol, and it was for all the special needs. Wow. And they would pick the bands and the singers they wanted, and Tyler would always do Michael Jackson. I love that. Because that is his favorite. So he would always do that, and they were just great. They even, from the time we moved out here and he started going there, they even gave him more independence than what he already had. Because I thought, like, oh, he has a lot. But there were other things going on, like being incontinent and things like that. And they took him to another level. And I realized, like, wow, a lot of these kids, they want to be integrated just like everyone else. They want to have friends. Yeah. They want to be treated just as normal and as special as everyone else. And you think that, depending on the disability, you think that maybe they're not smart enough or they don't know, but even they do. Even someone like Tyler, they do.
That's amazing.
Yeah.
And you kind of shared about his love for Michael Jackson. What other interests does he have?
God. Well, he loves Michael Jackson. He likes Disney. We go to Disneyland quite a bit.
Nice.
Yeah. Well, lately we've been going more.
Yeah.
And he's on his tablet a lot because he likes to watch videos,
right,
like music videos. He loves music, so he'll watch. He used to watch Usher all the time and just like lots of videos and things like that.
I love that.
And then we got him a supportive like bicycle. It has all these like attachments and things like that, so we could take him to the park every now and then, and he can actually ride a bicycle.
Right.
Yeah.
That's so cool. And then kind of going back to you and you're being his sole caregiver, how do you make time for yourself?
Oh my God. Why does that feel like a hard question for me?
Oh, that's real. That's real.
I don't know. You know what? It's been a progression.
Okay.
I don't think I used to, but I didn't even used to think about it. I just didn't. I just, I had boys. I'm a mom. I was always driving someone to school or picking them up. I was taking care of Tyler. So I didn't. I just think maybe in the last, I really want to say in the last maybe 5 years, I was, I think for a long time I felt like it was selfish.
Oh.
Because Tyler was so sick always, and I always felt like, that's selfish of me. He can't do this. He can't do that. He's nonverbal. Like, his life. Oh my God. And so I would be like, whatever I want to do, that's like irrelevant. Like, like
the backseat.
Yeah. Like I felt like so selfish about it, but I realized that, I have to be okay with like doing things for myself or feeling content or just saying, you know what, it's okay to have a bad day or have a good day, and you don't have to pretend all the time.
Yeah.
Yeah, because you start to like, I don't want to say live in pretend world, but when you have a child like that and it's an everyday job and it's consistent, it's constantly, they need you every day. They're the same every day. They need their meds. If they're really sick, they need all these things. So you kind of mask a lot, and you kind of just be like, it's not about me. Like, I have to keep him alive. I have to keep him alive, literally. Like, I know that sounds a little dark, but for years I was like, I have to keep him alive. Like, that's just my goal, nothing else. Like, so you got to think, like, my brain, I lived like that. Like, I have to keep him alive, and that means I have to keep him as healthy as possible. Like, you don't know, when the flu season would come in, I would just freak out. I was like, he can't get sick. He's had pneumonia before, more than once. So in my brain, I was always like, he can't get sick. He can't catch a cold. Like, and I just like stayed like that. So like, it took years for me to be like, when people would be like, well, what do you do? Like that question, I don't know. I didn't even know how to answer that question.
Right. And even then, like, your health, you need to be at your best health to take care of him as well. What do you do to take care of yourself, I guess, health-wise?
Well, I work out a lot. Like, I like to exercise.
Nice.
As much as I can, when I can. Sometimes some parts of the years are better. Like, I'm really locked in some parts of the year when I'm working out 3-4 times a week.
Nice.
And then others, depending on what's going on, if there's a lot going on, it's less.
Right.
But yeah, because I've worked out for like years, so that's just something that I like to do.
Yeah.
And then I take time out every now and then and go get with my friends and maybe have lunch, and I enjoy that. Yeah.
That's really good. Do you know of any services that maybe other parents could know about that they could reach out to if they have a child with special needs, or even just like feeling community,
Yeah, so that's a good question. It took me years to find out about certain services. And even when I would find out what they were, I would be like, why did I never know about this? As sick as Tyler was, and all the social workers and all the people, why didn't I not know about this? You know, so yeah, like, what kind of services do you need?
I know there's like UDW, but is there, I don't know if you want to share about your experience with UDW.
Okay, so he is a part of the Inland Regional Center.
Okay.
I don't know if you guys know about that. They offer a lot. They offer extra hours beyond being an in-home service worker. They offer respite. They give to families.
Nice.
You can have other family members do the respite care, and then that way you can have time for yourself. And they pay the respite care worker. So there's that, and they are the ones that I call or go to, the regional center, when I want to know about anything in the community. So I will ask my Tyler's worker, like, hey, is there anything going on in the community or whatever? And she'll say, well, if there is, I'll send you a flyer or a text or an email or something like that. Right. So yeah, there's things like that. Yeah. And then also too, it just depends on the community you live in, because I know like the churches and things like that, they offer a lot. So it's just you kind of trying to search it out and find it, you know?
Yeah. Did you feel like there was more support like in LA or like in the IE? Do you feel like there's becoming more support out here?
I feel like regardless of where it's at, I just feel like over the years, the decade, that because now, I mean, you even see commercials with about the disabilities and things like that. So I just think that it's both now, but I think it's just not because of where you live. I just think it's because of the progression of making people more knowledgeable about people with disabilities and special needs. I mean, you even have the streaming shows that are about like people with disabilities. But there was not that when Tyler was little. There was none of that. Like, I could go on forever about stories I've had that I had to deal with having a special needs child that people would not believe, being mistreated, like different things like that I went through. And this was like over like 15 years ago. Yeah.
What were some of those challenges as well, though, for you?
So back then it was a little different. Being out with Tyler was a struggle. He was on a ventilator. So I used to use a twin stroller that you would use for twins, and I would put his ventilator, because back then the ventilators weighed like probably like 10 pounds.
Wow.
So I would put the ventilator in the back and him in the front, and the nurse would go with me to every doctor's appointment. I would have to transfer him and do all these things, and there was times I just felt like even the people that you expect the most from were not that understanding, were not that kind. Like, I have stories, like I remember Tyler when he was born, he was on a lot of medication, a lot. So when his first initial set of teeth started to come in, they were like discolored, and they were like this dark color, and I went to the doctor and she says it's probably from all the medications he's been on. It's been a year.
Right.
So she's like, I'm gonna give you a referral to go to the dentist and see what they can do. So I will never forget, we went to the dentist, lugged the ventilator, the twin stroller, me, the nurse, like we're doing, and then we get in there and they treated me so bad. Wow. They treated me like it was my fault.
Wow.
I remember leaving out of there in tears, like, why did they treat me this way? Like, what did I do? Like, you know, like, it's not my fault his teeth are coming in discolored. And I had to get a referral to see a different doctor, and inevitably they pulled all the bad teeth. And they said, okay, when the next set comes in, they're going to be fine. And they were. But the initial struggle that I had, you got to think, people on the outside, they don't know the struggle. Like, just to get here today, to come to this appointment was a struggle.
Right.
Like, you know, it took forever. And then, you know, I had to prepare him and get him ready, bring all his meds, do all these things. And then you get there and they are just like, just mean to you. You know, it was just kind of like all of those things over the years, it just gives you a reality check. And I think that's why you kind of just like block everything else out, and you just kind of you're on autopilot.
Right.
Yeah.
And even just like treatments like that, which are insane, by the way, how has that kind of shaped you as a person and how you treat other people or how you go about life?
Oh my God. Like the special needs to me now, like I just look at them so different.
Mm-hmm.
Like when I was a teenager, I didn't know. I didn't know.
Right.
You know, there were just terrible names. You know what they are, that they will call them, and because you just didn't know.
Yeah.
You weren't knowledgeable. And so now I'm like so sensitive to it.
Mm-hmm.
Like I'm so sensitive when I see them to know, like, they want to have conversation. They want to go to the family cookout. Mm-hmm. They want to kick it. They want to, like, listen to music and go to the parties. Right. And, like, you know, they want to do those things. Mm-hmm. Because Tyler wants to do those things.
Exactly.
So for me, it's just like this connection when I see someone's special needs, or I see a parent that has a child, whether it's severe or not, with special needs. And I know the difference now between the different types of disabilities. I know the difference between someone with Down syndrome, someone with cerebral palsy. I know the difference. You know, before there was no difference.
Right.
You know.
Just understanding that.
Yeah, that there is a difference in each person that has their own disability. Beyond the disability, what I think people don't understand is that they have other physical issues they have to deal with that come along with that specific disability, you know.
Yeah.
So I think that part too, I understand that when you see them on the outside and you think, oh, they're just special needs. No, each disability comes along with other physical aspects that go along with that.
Right.
Yeah.
And then how can we, or people who aren't maybe attached to somebody's special needs in their daily life, how can we kind of get our audience to be more understanding or more informed, or maybe just, you know, like...
Yeah, I think that, like, people should understand that if you see someone that has a child, an adult, any age, any form of disability, that I don't think that they understand that people are not offended by questions. Like, people see me with Tyler, and because he has cerebral palsy, so he has a way that he walks with his walk, because his lower extremities are not like strong, and he wears braces, and they talk to him and he doesn't respond the way they expect. So I think that sometimes people just stare because they feel awkward, but I think they don't understand that that we're like okay with answering questions. Like we're okay with, like, you know, actually it's cool. Like if you want to know and you want to ask me, I want to inform you.
Right.
Yeah.
Yeah. I love that.
Yeah.
I know you kind of shared in the article about, you know, having your other two sons and maybe possibly them taking care of Tyler as you get older, or how have you planned or kind of thought about, like, where does the care transition to?
I'm so blessed that he has an older brother and a younger brother. And I always tell them, like, I should not have to worry. Like, he's in the middle. If you want me to turn over in my grave, that means you guys did not take care of him.
Right.
So we've already done a conservatorship for Tyler.
Oh, wow.
So we went through the court process to do that. And we've already talked to our kids about it.
Wow.
And even my youngest son, sometimes he'll make comments like, you know, well, he's not going to be alone. Like, he'll say those things to me. So it's just like, even though we've had those discussions, it's an unspoken thing.
Yeah.
Like, you know, that I'm blessed. I know some people don't have that, but that he won't end up in a facility, you know. And I feel bad sometimes because I'm like, there's so many people that do not have that.
Yeah.
They might be older than me. They might be an older person and their kid is already like 50 years old. And they don't have those options.
Right.
So for me, it's more of a comfort that I know that I have two grown boys who are super responsible. They are great adults, and that they love their brother. And even now, like, my youngest helps me. Yeah, he's Tyler's respite care worker. Wow. So along with his own job, like that's a second job.
Yeah.
Like, he helps me with Tyler.
Yeah.
So I have a lot of support with family. Like, even my mom, she's older now, but a lot. If it's last minute and no one's available, I we call my mom. I'm like, can Tyler come hang out with you? She's like, yeah. And then he goes and hangs out with his grandma. Right. So for me, over the last 29 years, I've had support from family, but it makes me sad sometimes when I see people in their special needs children are older. Yeah. They're getting older and they're already like 70 or 80, and I'm like, that is scary. You know, like they're going to go into a facility if something happens to you. Right. And then I know, because I have a special needs child, they won't be happy. It's like they live on consistency. Yeah. Like Tyler is happy if his life is consistent. If he gets up every day, he goes to his program, if life is consistent, he is happy. Right. If a life is inconsistent or there's some roadblocks, he starts to like not be happy, or like I told you, he becomes upset. And I know that a lot of people with special needs deal with that. And the sad part is I know that if they had to transition, they would be depressed, or they would probably go downhill because they live on consistency. Right. You know, even the smallest things. For Tyler, he's like, this is my whole life. Like, you get up and you go to school and you go to work, I go to program, and he's like, this is what I do. Yeah. Like, 'cause he compares going to his program to everyone else. Right. So if my son has to go to work, he'll say, he went to work. He's like, but I'm going to program tomorrow. Exactly. And I'm like, yes, you are. And so for me, it's just like, it gives me a reality check that we expect so much of ourselves, and they don't expect that. Right. They are like, this is my life and I'm happy with my life. And so for me, it's just like a real reality check. Like, why can't we be that content? You know, we're always pursuing, oh, I wanted to do this, or I need this, or I need, you know, and they are just like, if I live the rest of my life like this, I'm successful. I did something, right? You know.
Exactly. Okay, so just within the system, and even being fearful of, like, you know, maybe someone with special needs aging out, their parents not being able to take care of them, and being scared that they could go to a home or a center, what kind of, you know, what would be the ideal, right? Because we shouldn't be scared of people that are supposed to help, right? Like hospitals and care. Yes. What would be the ideal kind of center for people with special needs and aging out, and like what changes, if you could make changes, right? Like what would you do?
Right, because I think there's always been a stigma with hospice or like facilities. Like there's always this stigma where people like, don't send them there. They can't go, don't do that. They can't go there because then, you know, they feel like each and every one you get mistreated or they don't take care of you. So I just think that the facilities that want to take in people with disabilities or that are there to help, I just feel like if they can make it an open book, like, you know, for other people to, I think it should not feel like you're not allowed in there. Even if you're just like a friend or family member, which I know you can go visit and do those things, but I just feel like there needs to be more time and effort put into the stigma of those places being like quote unquote bad. Yeah. Like, you know, even we have grandmothers and elderly people who are like, if I get sick, don't ever put me in, you know, there, because there's like this stigma on it. And I think the same for people with disabilities, you know, maybe it's not cost effective, where they don't always have enough people to give the time and the, you know, that they need to the people when they go there, right? You know, which could be an issue, you know, that they have to work on, you know. A lot of times now it's how the places are funded. So I don't know, maybe if it would be because funding is not there, whatever. But I think it's all about their emotional state and knowing if they're happy and knowing if they even them, if they need therapy, even if they need therapy, right? You know, just like we need therapy. I need therapy. Yeah. Like, you know, like, so I think that taking care of their emotional state and making sure there's people there that can give them that, like, therapy or like different things that make them feel, you know, content.
Right.
Yeah.
And I think my last question for you is just any tips or advice you have for parents that are kind of in a similar journey as you are?
Yes. What would my tip be? I think it would be just be clear on if you're struggling or what you're dealing with. Like, if it's hard, say it's hard. If you need help, say you need help. If you need therapy, say you need therapy. Like, because the years, like, you blink and the years go by so fast, and then you think to yourself, if I could do it over again, I would have, I would have done this or I would have done that. But I feel like, I think the help is there more now. It's 2025. Tyler was born in 1996.
Right.
So I think the help is more there now than it was 20 years ago. I think, like, a lot of parents went home with kids and they just struggled.
Yeah.
And people just didn't know they were struggling, And so I think, like, if you need help, you should just say, I need help. You should just reach out. You shouldn't feel bad about, like, calling and reaching out or doing whatever you need to do.
Right.
And hopefully you have family that's supportive, because then it makes it a lot easier.
Yeah.
Yeah.
Wow. Thank you so much, Crystal, for being here.
No
This has been so great.
Yeah,
Thank you for your knowledge and sharing your story with us.
This was great.
Thank you. Hello and welcome back to BVN's Care in the IE podcast. My name is Alyssa Hall, and today I'm here with Dr. Wessam Labib, who specializes in family and geriatric medicine at Loma University Health. Welcome.
Thank you.
Thanks for being here.
Thank you for inviting us.
So can you kind of, for our viewers, let us know your background with geriatric medicine?
Sure. So I went to geriatric medicine at UCLA. That was my fellowship training after residency in family medicine.
Nice.
At that time, that was 2009, and that's when I joined Loma. So it's around 16, 17 years ago.
Wow.
I'm currently the division head for the geriatric medicine at Loma.
Nice.
And also I'm the medical director for the PACE program at Loma, which is a specialized elderly geriatric clinic.
And then can you kind of share with us what exactly you do in your practice?
Sure. So I do separated my practice to the primary PACE geriatrics, where I actually see primary care patients in the geriatric age. I also have been running the specialty clinic in geriatrics, where we actually see patients with dementia and osteoporosis and other geriatric syndromes. This is a specialty clinic, so it's by referral from the primary care.
Amazing. And so in your experience of dealing with patients, and a lot of them have caregivers, what would you say is a big concern amongst them?
So caregivers for geriatric patients or even non-geriatric patients, any patients that require somebody to take care of them. We always, in geriatrics, we have what we call the activity of daily living and then instrumental activity of daily living. So activity of daily living is the typical things like eating, transferring from the bed to the chair, going to the bathroom, stuff like that. But instrumental activity of daily living is like cooking, laundry, finances, medications. Typically patients that miss any of the activity of daily living or instrumental activity of daily living, you'll need somebody else to help them to do it. And that's when we consider that you have a caregiver, right? So that kind of range from patient with congenital illnesses, birth defects and things like that, patients that had accidents, trauma, or geriatric patients who are just from age, there's things that they're limited to do. But also it comes to also mental illnesses like dementia, right? So dementia patients require somebody, either family members or paid caregivers, to take care of some of their instrumental activity of daily living or activity of daily living.
Right.
So that's kind of how you look at the big range of available caregivers. A lot of times I find family members are the caregivers of their loved ones without them knowing, without them thinking that, oh, I'm the caregiver for my dad or I'm the caregiver for my mom, because you're managing their finances, you're paying their bills, you're reminding them of taking medications. So it's a very generic term, and I think there's more caregivers than we think.
And even caregivers of loved ones who have been doing this maybe their entire lives, say like their children. how can they make time for themselves in between?
So caregivers, it's everything has a limit. So if you're a caregiver 24 hours 7, there's no possible way that you'll be able to give the loved one all of the care and the attention that you every minute exactly the same. After a week of doing this, you're going to give less and less and less. And therefore, it is critical to do self-care. It's critical to take breaks.
Right.
Those breaks can range from a few hours to even few days. Of course, one of the things that you always have to consider talking to your to your healthcare providers or counseling, the internet even, is how can you fill in the gaps when you're unable to take care of your loved ones?
Right.
Because as a caregiver, you must give yourself some breaks. Because think about it this way, if you are not going to take those time to yourself and take care of yourself, you're definitely not going to be able to take care of your loved ones. And you will feel it right away. A lot of times we underestimate how our loved one feel our stress. And we think that if we're just with them 24 hours 7, even if we're tired, even if we're exhausted mentally or physically, they will be happier. But a lot of times we don't realize that they see that you're tired, they see that you're burned out, and they start feeling guilty. They start feeling uncomfortable that they're putting that much load on you.
Right.
Compared to if you're taking some time to yourself and you're re-energized and you refuel yourself, come back with full energy, they see the happiness in your face. They see that you're actually giving 100%.
Right. And even with kind of like how patients can feel that guilt, I'm sure that caregivers can also feel guilt as well. So how can they kind of combat that with that self-care as well?
And that's the part that kind of becomes tricky, right? So our patients feel guilty that they're putting so much load on their caregivers. Our caregivers feel guilty because they're not giving the 100% and sometimes the 200% to their loved ones. But as you know, that you're not taking care of your loved one for just one day.
Yeah.
You're not taking care of your loved one for a week or two. It's probably going to be longer than that. And this is something that it sometimes can be for life. Patients who are younger that had traumatic events, they might be for years and years and years. If you want to give a quality caregiving, you have to take care of yourself first. It's very similar to how we tell our patients to live a healthy, with good quality life. You have to exercise and eat healthy. It's very similar to that. You can just eat whatever you want to eat because it's enjoyable and there's a lot of pleasure related to food, but then not realizing that it's increasing your cholesterol, increasing your chance of getting a stroke or heart attack, and then that affects your ability to have quality of life. But taking away some of the things that you think you need to do, and go to things like exercise and go to things that relieve stress, improves your ability to live a quality life. Very similar to caregivers. If you take away some time for yourself, even if it's just a simple, quick trip to the mall, to walk shopping or just walk by yourself or go out with friends, you are able to give a quality caregiving to your loved one.
Amazing. And what resources could they use or reach out to? Any other lanes that they could take, say if they did want to like walk around at the mall, like to entrust somebody with their loved one? I'm sure that's a lot of pressure as well, but what advice could you give to that?
So there's some formal ones, kind of more government available websites. The Elder Care Locator, it's a .gov website where you can just put your zip code of where you live and it will give you a lot of resources. Most of it is county and state resources where they can provide you any support that's available in your county. And you will find there some caregiving companies that part of the county or some kind of a support related to the state. For example, IHSS is a state support that actually pays for a caregiver to help patients who needs that, who are medically qualified to get caregiving. They can even pay the family members. But also going outside what's available in the state. So there's a lot of private companies that will provide caregiving for an hourly rate and so on. Other than that, there's other programs, including a program that I take care of in Loma that's called the GUIDE program.
Okay.
GUIDE is GUIDE, G-U-I-D-E. It's a new Medicare program that started actually July of last year. There's only 350 clinics in the United States that actually operate under the GUIDE program. The GUIDE program is designated to give extra support to the caregivers of dementia patients. So if you go on the web and just search GUIDE and CMS or Medicare, there is a great map out there that will show you all of the GUIDE clinics that might be closer to your residence. If you take your loved one to be evaluated by the GUIDE program and get enrolled in that GUIDE program, the Medicare will actually pay for a caregiver with a specific amount of money or a specific limit per year to offload the loved one, to offload the caregiving. So they will pay for an outside caregiver to come in and offload the family member for dementia patients. So that's one. The second one, which is actually even more common than GUIDE, is called the PACE. I mentioned earlier that I'm the medical director for the Loma PACE Center. PACE is the program of all-inclusive care for the elderly. PACE is a whole comprehensive geriatric outpatient and inpatient care clinic where patients that get enrolled in PACE will get provided transportations, meals, caregiving at home. The job of the PACE programs is to keep patients at home instead of going to the nursing homes. So a lot of our caregivers would love to keep their loved one at home rather than getting burned out and they have to put them in an institution to take care of them. And programs like PACE provide that to them. There are specific criteria when it comes to insurance and so on, but it's available online or anybody can look it up. But it's another program that gives significant support to the caregivers. And in that program, it's a whole coordination. So that PACE programs have providers, nurses, case managers, dietitians, physical therapists, occupational therapists, even transportation vans. And it's not just for dementia patients. It's for any patient that has a medical condition qualified by the state that requires somebody to help them at home. And then the PACE program comes in either by bringing caregivers from outside to help those patients at home, or even finding a way of how their family members can be employed to a certain degree, so that PACE program can come in and provide that care at home, so the family members don't have to put the patients in an institution for somebody to take care of them. And that provides a lot of satisfaction, either from the patient, from the caregivers, that now the patient's getting that much support, but also the caregivers are not getting burned out. They actually have somebody from outside that can help them.
Right. And what typically leads to caregiver burnout?
I think the most common reason for caregiver burns out when they feel inadequate. A lot of times, I believe family members want to do 100% for their loved one, parents, husband, wife, but the issue comes when they feel that they're not doing enough. And that becomes kind of a vicious cycle between I want to do more, but I'm so exhausted that I can't do more. And that causes the burnout. The other thing, by studies and research, we found that the caregivers for dementia patients get actually burned out more from patients' behaviors. So the most common reason for burnout for dementia patients' caregivers is the behaviors of the patients more than the physical needs of the patient. So most caregivers have no problem helping the patient go into the bathroom, helping the patient transport, helping the patient even food, taking them to the doctor's office, doing anything for them. But once dementia starts presenting by other behaviors, which the common one is agitation, for example, that's when the caregivers get agitated. So one of the things we do in the memory clinic in Loma is that we always focus on what is the behaviors of the patients and how can we treat that, not just for the patient's safety, but the fact is if you don't appropriately treat the patient's behaviors, you're significantly exposing the caregiver to get burned out, and then who's going to be taking care of the patient if that happens.
Right. How would you go about that, though? How to kind of treat their behavior?
So that becomes tricky because your dementia patients typically don't actually give you that good history to tell you how they act or how they feel. And a lot of times when it comes to the memory clinic interviews, becomes a kind of a more group interview where you involve the family members as well in the interview with the permission of the patient, and then start hearing from the patient and the family members. how the patient reacts, if there's any agitation or not. But you have to ask the questions because typically patients is not going to share it. And family members might feel like they're kind of telling on their loved ones if they're trying to share that they have these behaviors, so they try not to say it. And it require a little bit of experience with the providers that doing the interview to try to capture those things without putting the patient in a more embarrassing situation or having embarrassing conversations. But once you recognize that there's some behaviors, you have to deal with it very seriously, because you know that first, patients are not happy when they're agitated. So you have to understand that also patient would love to not be agitated, but also caregivers getting burned out. And there's a lot of medications, unfortunately not one major group that's very effective, but there's medications that really work to lighten those type of symptoms and help the patients and the caregivers.
And I can imagine too, it's very emotional, in terms of patients with dementia as well, maybe forgetting who their loved ones are, how that could possibly take a mental toll on the caregiver. So is there like maybe support groups or something where it's somebody that they can talk to or something else that they can rely on in those moments?
Absolutely. So there's a lot of support groups out there for dementia. The most common is the Alzheimer's Association. So if the patients reach out, and by the way, dementia, obviously there's many types of dementia. Alzheimer's is just one type of dementia. It is the most common type of dementia. But the Alzheimer's Association really serves dementia patients in general. So there's a lot of classes with the Alzheimer's Association. There's a lot of governmental resources also for dementia. But again, the most common that became really, really great most recently are the guide clinics, which is there's few in the area, and Loma is one of them. But reaching out to figure out what resources available out there is a critical thing. Patients also, you brought a good point. Caregivers get really emotional when they start seeing patients not remembering them, or not remembering great memories, or not remembering even just normal activity. And it is sometimes we say in the professional field of geriatrics that sometimes the dementia patients are happier than their caregivers, because dementia patients tend to not remember things, but some of that what you don't remember is bad memories too. And they might not look as happy to you, but in general we believe them being forgetful to things are most likely a lot of times not as painful as the caregivers around them that realizing that they're forgetting things. So as them they realize more, not because my dad and my mom not forgetting means that they're suffering, that might help. Now, this is with the exception of early situations dementia. So when there is an early case dementia where patients just been diagnosed with a mild case dementia, it actually becomes a little bit more disturbing to the patient, because the patient still, what I always say, they still remember that they're forgetting. So the patient start realizing, I'm not remembering things that I used to remember. And that becomes cause of anxiety and depression to the patient. But beyond that, when you get to moderate stage and severe stages, patient doesn't bother as much of the fact that they're not remembering things, because it's just not in their memory. So I always advise caregivers to look at it from that side. I know it's painful to you that they can't remember, but think about it from their side. It might not be bothering them as much as it's bothering you. So keep the focus on the patient. How
can they continue to keep that focus on the patient? Especially, I was going to touch on, you said that they can reach out to other sources like hospice care and things of that nature, but what if they're maybe afraid to, kind of let go a little bit or take some time for themselves? How can they work around that?
Again, there's a lot of professional caregivers out there that they're educated and they're familiar with dementia cases and they understand how to deal with dementia patients. So don't limit the resources without trying it. I'm not saying that every paid caregiver out there is good with dementia patients or good with, in general, patients that require caregiving, but try a couple of resources because it will be really heaven sent if you have the right resource. You'll find your life was enriched significantly, but also you're enriching the life of your loved one because, again, as I mentioned before, if you get burned out, nobody's going to give the right care to that. You as the family member will be always the best caregiver, but if you're not giving your 100%, it's not going to be the same.
Right. And then if you could share any stories in your experience of maybe caregivers that didn't reach out for help versus caregivers that did.
Absolutely. We see that a lot actually in the guide program, since it's actually relatively new. So
Okay.
it started only again since July last year, where patients that had known in the memory clinic for many years with caregivers that we felt our hands are tied because those caregivers were really suffering through taking care of their loved ones alone. They had no support. Now with the guide program, because we have care navigators, they have a contact with the care navigators, the memory care navigators, once a month at least. And if actually you don't reach out to the care navigator will reach out to the caregiver.
Okay.
So it's our obligation to reach out and make sure they're doing well.
Right.
But also the fact that we're able to connect them now to that respite care, where somebody, a paid caregiver, can come in and offload them. We have found significant changes in the testimonies we hear from caregivers who I had known for years before the guide program, being burned out every time they're coming in. They're always anxious of what's next. They're not sure if their parents going to allow them to take them to the next appointment for the doctor or not. Or is it going to be a fight? If their agitation is going to be controlled or not. And now I see that they come in and they say, oh yeah, I talked to this caregiver yesterday or the care navigator yesterday and they told me to do this or told me to do that. The amount of resources we're able to provide them, it just really changed their lives.
That's really great.
It doesn't have to be done for an outsider. Conservatorship can be done for the family members, either parents or even daughters or sons, where it's a legal paper that goes behind a judge, and it becomes very legal for them to now make decisions for the loved ones moving forward. I've seen it many times in my practice where family members get surprised with the fact that they couldn't make any decision with the bank, or they couldn't make any decision with Social Security if it's an older patient. And they realize that now they're going to have to go and try to work on those legal papers, and it takes months sometime to make it happen.
Right.
So planning for that from the beginning is something critical.
Yeah. And for those who don't have maybe family members that they can alternate with, do you have any advice for them as well?
Look for companies that provide caregiving. A lot of them can be cost effective, especially if you're not using a lot of hours. Look for church support groups. Look for county and state organizations that provide that. But you need to look outside the box and know that sometime a trained professional caregiver will still, again, as I mentioned earlier, family will be the best caregivers, but they might still give adequate care in the gaps where you're taking care of yourself.
So could you give us your top 5 self-care tips that we could offer to caregivers?
Well, let's see. I know that for sure I can probably say mentally first, mentally and emotionally together. Know that you're doing your best, and your best might be different from another person or another caregiver, but I know you're giving your best. So have a belief in your heart that you're doing your best, and find what we earlier said, which is those breaks that you need mentally for yourself. That can be as simple, walk in the mall, can be just getting out for 2 hours from the care environment that you're in. So that's the mental one.
Right.
For the physical, take care of your health. If you're sick and you're not taking care of your health, who's going to take care of your parents? Who's going to take care of your loved one? Who's going to take care of your son or your daughter?
Right.
So you have to take care of yourself physically. Exercise, eat healthy, and then finally spiritually. Have a spiritual connection. If you're religious, lean more on your religion to help you with your support mentally, to allow you to see what's beyond the illness of your loved ones.
Amazing. And then how do you, implement those for yourself as well in your career field?
That's actually a very critical question, and I actually, believe it or not, I actually have some patients that they start the visit with me asking me how I am doing myself. And I so appreciate that, because the most common question we do when we enter a room, we ask the patient, how you doing?
Right.
And some of my patients asking me how I am doing. And it's very encouraging to know that your patients sometimes worry about their physicians and how they are taking care of themselves. I think I probably can do better, but I feel exercise, physical activity, but also I always felt, since our job is very mentally exhausting, that if I have more physical hobbies, that helps. So building things, I like to build things when it comes with wood stuff. I'm not good at it, but it helps kind of relieve some of the stresses and allows me to refuel.
Right, it can be meditative.
Absolutely.
For sure, that's really great.